Rahul, big relief for parents, children alike, and a big boost to fight against the pandemic amid this Omicron threat. You were explaining, please continue.
Nabila, what I was explaining is that this category of 15 to 19 is a very critical category. As far as the 2011 census, the last census in the country, there are over 10 crore people in this category. Now, this is the category of students who go out. These are the category of students who need to appear for board exams, for competitive exams, practicals, and several others. And that is why they need to be out, and that is why they need to be insulated against a new variant of the virus, which is spreading faster. So while the Prime Minister listed out the kind of achievements in terms which have been clocked since April last year when COVID-19 hit India, the kind of infrastructure which is available today, but the fact remains that in the meeting he had held 2 days back, he had talked about Satark bhi and Savdhan bhi, means he had asked the country to exercise great amount of caution. Now, what everybody was watching out for, two elements, that is the booster doses, and the second is, will there be more restrictions? Now, the Prime Minister very categorically, by not mentioning any restrictions, has clarified that there is right now a sense of confidence in the government and coordination on with the state governments that any crisis can be tackled, and it will be early time to impose heavy-handed restrictions in the country is concerned. The second, of course, the booster doses. That's again a very pragmatic decision, because if you vaccinate the health workers and the frontline workers for booster doses, means the infrastructure which has been created, the lakhs of beds created, the oxygen beds created, the ventilators put in place, 3,000 PSA oxygen plants operational, all that will have, that infrastructure will have health workers and frontline workers to man them in case there is a spike. As experts are saying that it is inevitable that there is going to be a third wave in India. Now, the health workers need to be insulated. The third element is also critical of vaccinating comorbid above 60 people on the advice of their doctors. So there will be one, no panic and no instant rush, or one. And second, it will be checking in terms of fatalities, because that's also not a very enthusiastic thing. It will be spread panic. As we saw that in the second wave, there were 2 lakh deaths, which is second only to Brazil in the second wave in the world. And that's why there is a very pragmatic decision which has been taken by the Prime Minister. Also talked about in terms that the government wants to ensure that people stay vaccinated, people stay cautious, people get booster dose, and so that the economy, which he mentioned, has performed better than several other nations in the intervening period between the second wave and today. I think there is also a very cautious eye the government is keeping on how the Omicron moves, because any severe restriction at this time may be debilitating and extremely killing as far as the economy and the revival which has been on for some time.
Right. Speaking on the restrictions per se, Prime Minister, of course, never mentioned on restrictions extensively, but did remind the population, our citizens, not to let their guard down. While he said that, he also, of course, declared that vaccine for kids will be rolled out on the 3rd of Jan. Booster doses for healthcare and frontline workers will be rolled out on the 10th of Jan. Kids vaccine on the 3rd of Jan.